Hey everybody, Tim Wyatt, physical therapist here with Aspen Rehab Physical Therapy in Coral Springs. I'm here today with my patient Maria Marta.
Correct.
It's very important to say the Spanish names right, because if you don't, it's just not correct.
Exactly.
How are you today?
Fine. Very happy. Today's my last day
Yes.
therapy, and I feel awesome.
You're graduating.
I'm graduating, exactly.
Awesome. Maria Marta is graduating from Vertigo treatment today, right?
Yes.
So let's talk about that. So we shoot these videos because there's lots of patients out there, people with friends, family, patients, I'm dizzy, or I have the room is spinning, or I have these symptoms and I got a pill, or I didn't do anything, or I never even went to a doctor because I don't even know that you can treat this. It's super treatable. So let's tell everybody what you had. So we evaluated you and we found two things. Two things is her neck had very tense and spasmodic muscles which were providing compression that occlude and compress on blood vessels and muscles that can trigger dizziness-like symptoms. So the first part of her treatment was treating her neck. The second part of what we did was we found that in your inner ear there's 3 canals that have fluid in them, and one of the canals was not allowing the fluid to flow. So a lot of times you'll hear patients talk about crystals or blockages or things like this. Their formal name is called otoliths, which is basically the kidney stone of the inner ear. And when we talk about ear, we're not talking about the hearing part of the ear, we're talking about another part of the ear. So what happened with you is you rolled over, you got out of bed in the morning and
Not even, I just turned in bed.
Turned in bed and the room started
getting
spinning.
up, and then so since I already had it, I knew that it was vertigo again. Horrible feeling, and so I just kind of calm yourself, close your eyes. I know you say not to close your eyes,
right?
But it's natural. You close it because you don't want to see what's going on. The room turns around.
Correct.
Everything, you feel your eyes like popping out.
Yep.
It's like forces pulling them. And then suddenly it goes away.
The worst roller coaster of your ride, like you're just being slingshotted and spun, right?
Yes.
Which is different than a second type of dizziness, which is just general imbalance, like your head is detached and your feet are on the ground and you're just floating. You had a very specific type of vertigo that we call BPPV, and that was yours. That's that violent room is spinning and you want to get off the ride, but you can't. Okay, so patients will feel room is spinning, nausea, in severe cases, vomiting, in the worst cases of types of vertigo. So we did the treatment with you. You did super awesome, amazing. You received treatment on your neck. You received treatment for the positional stuff of the inner ear, and you started feeling better how many days after your first session?
With the first session, I would say 2 days later.
Okay.
Yeah, I started to feel better until it's gone. It's perfect.
Excellent.
And I've had 5 sessions here.
So 5 sessions, and would you say you're symptom-free?
I'm symptom-free.
None at all?
Not at all.
So you can roll over in bed, you can bend down, you can look up, and no room is spinning
I've been doing it, testing it at home.
Of course.
Because I wanted to let you know.
Exactly.
And it's perfect. I'm back to normal. I'm back to happy.
Take your inner ear for a test drive and go.
Exactly.
Exactly.
Yes, I'm very happy.
Because can you imagine how just debilitating not being able to turn your head out of severe fear that's going to happen? A lot of our patients are like, I don't even want to turn my body. I don't even want to look down. I don't even want to go to sleep and not do anything because, God forbid, I move my head just that one little bit, it triggers this violent response.
Yes. And I work, and and it was a hassle because I couldn't bend over, I couldn't pick up things from the floor.
Exactly.
And the computer, there were moments where the computer bothered me.
Right.
The going up and down.
Right.
So, but now it's perfect.
Perfect.
Yes.
And one of the other things with you is there were certain eye exercises, right?
Yes.
Following and tracking.
Right.
So one final thing with Maria Marta is that she was given exercises for her eyes, so not for her vision, but the ability of her eyes to track. So these are what we call VORs, or visual ocular reflex, which is kind of teaching your eyes to be coordinated again. So as your eyes move, it catches up with the signal of the brain to then keep everything in focus, because when our eyes don't move relative to our head motion, it sends a funny signal to the brain, and the brain's like, oh, we're all over the place, and that's when we get dizzy. So for you, you actually had a combination. It was neck, it was inner ear, and it was some eye exercises. You felt better in a couple of days, and now after just 5 treatments, you're completely symptom-free, which is great. So awesome. Okay, well thank you for that. I'm glad you're feeling better.
Oh yeah, thank you.
Good.
Thank you, and all your personnel, because
That's what we do.
everybody treated me like home,
Awesome.
and I feel good.
Our pleasure. That's why we do it.
Thank you.
Yes,
Thank
you're
you very
welcome.
much.
Awesome. So Maria Martha, thank you very much. Listen, anybody who wants any information on dizziness, vertigo, imbalance, even if it's just walking, you use a cane or a walker and you don't feel unsteady, know that Aspen Rehab Physical Therapy in Coral Springs is a specialty center for these types of conditions. Anybody who wants some help, take a look below. We got our website, we got the phone number, you can give us a call. There's no charge for it. Give us a call, shoot us an email or something. We're happy to walk you through any of this. We do take all major insurances, and of course we do offer discounted cash pay options. So don't let there be a reason not to call us. Despite COVID, we are essentially open and practicing essential and critical cleaning, cleansing, spacing, and everything else. Don't let that be something to stop you. If you feel safe to come in, give us a call. We'll be happy to help you resolve your vertigo like Maria Martha.
Thank you very much.
My pleasure. Take care, everybody.